So the most common cause, two-thirds of the causes, is because of the food particles. So anybody can choke on any food particles, but most commonly the babies and the elderly, where the swallowing reflexes and the gag reflexes are not so good. So these are the subset of patients who have choking problems. If you look at the US data, I think every 5 days one child dies because of choking. And if you compare it to India, definitely the Indian data will be more. So that is the seriousness of the incidence of choking conditions. And the other reasons for choking is you're taking a bigger bite of food, like for example, a large piece of meat or large piece of food product, eating it fast and eating while lying down. And sometimes when you're talking or doing some activity, running around and eating, and most commonly in an intoxicated patients, like a patient has consumed an alcohol just before the food, they are the ones who are commonly affected with choking, and that's how they end up with the problems.
And when
And
sorry,
sorry to interrupt.
no, please.
And in kids, other than the food particles, the toys, the smaller toys, actually the toys will come with a prescription that it has to be above certain years of age.
Yes.
But if it is not done in the right way, they can choke on the smaller bits of toys, batteries, smaller batteries, buttons, and some of the food products like larger pieces of vegetables. And most notorious things are the nuts and the vegetables. The problem with these are if they get into the trachea, the windpipe, once they go inside, because the water content inside the windpipe, they start swelling. So even the partial choking can become a complete choking over the time, and it is very difficult to remove that as well. So these thing the parents and everybody has to be very aware. These small nuts and small vegetables has to be kept away from the children, or should be given in a smaller pieces under the supervision.